Good to go.
Hi, everybody. I'm Sharon with Parent and Family Engagement here at DU, and I'm joined by Tyler, who is also in the Parent and Family Engagement office, and Sarah Robbins from our Health and Counseling Center. Can everybody just, say something real quick, wave at me or say, hey, yeah, we can hear you? Or maybe put something in the chat menu that, oh, yeah. Good, great.
Awesome.
All right, glad that you can hear us and everything's ready to go. So welcome to this week's webinar. Our topic this week is health and wellness. Real quick, I want to wrap up from last week. There was one question that we had that hadn't been sent out to all of you through email as a follow-up. We didn't have the answer. We put it on the Facebook group, but I think some people may have missed it. Centennial Hall's residence hall is air conditioned.
How is your hall?
Sorry, no, Towers, thank you. Centennial Towers is air conditioned. That was a question that came up last week. We have 3 residence halls on campus that first year students are, residing in. JMAC, which is our Johnson McFarland Hall, we all refer to that as JMAC. Then we have Centennial Halls and Centennial Towers. So out of those 3, JMAC and halls, they are not air conditioned. So make sure that your student or their roommate has a fan. Standing oscillating fan is a really good thing to have. Purchase it before you get to campus and maybe have it waiting for you at Bed Bath & Beyond or Target or something like that, because the local area runs out of fans. The other universities have already started before us, so that's a good thing to have. But, to recap, JMAC and halls, they do not have air conditioning. Towers does. So there you go. That's the wrap up from last week. Nice and simple. So I'm going to go ahead and hand it off to Sarah to give a little information about the Health and Counseling Center here on campus. Later on, after Sarah is done, we will open up the chat menu for questions, but please, try to hang back on your questions for now. And, after Sarah's done, then we'll go right into that, okay? Welcome, Sarah.
Thank you. Hi, everybody. My name is Sarah Robbins, and I'm a healthcare administrative specialist at the Health and Counseling Center. So if you're going to give us a call, you're going to talk to me or one of my colleagues who are part of the administrative support team before you talk to anybody else. So I think the first thing I want to talk about today is sort of how the Health and Counseling Center runs and some requirements that you need to meet so your student can register for classes and health insurance and the health and counseling fee. So the first thing is that the Health and Counseling Center is an integrated center. We have 4 sort of departments within our department. We have counseling and medical, which are most utilized, but we also have our health promotions team. And so we offer like free STI testing, informational stuff, things like that. All of that is run through our health promotions team, and we also have our CAPE, which is our Center for Advocacy, Empowerment, Prevention and Empowerment. And so we all work really closely to make sure that your students are having a really healthy experience here on campus. One of the requirements that your students need to meet coming into DU is that you must have health insurance. We do offer a health insurance program. We fondly call it SHIP. It stands for the Student Health Insurance Plan. It's actually, we contract out through United Healthcare, United Healthcare Student Resources. And it's a pretty comprehensive program. It is, if you are familiar with the Colorado Marketplace, it's a gold tier plan, and we expect that if you're not going to opt into our plan, that your plan is going to be pretty comparable to that. And so the SHIP, you will be able to opt in or opt out of the SHIP once your student has registered for classes. And if your student is for some reason not taking more than 6 graded credit hours, you will need to come into the Health and Counseling Center. We are located in the Ritchie Center on the north side of the building, 3rd floor, and we can manually enroll your student in the health insurance plan. Some of the things that our plan covers that some other plans don't cover is study abroad coverage. So if your student were to have an emergency or even have like a cold or flu while they're studying abroad, everything is covered there. And repatriation if something were to happen overseas and your student gets really sick and needs to come back, repatriation is covered. So things like that, and certainly if you have more questions about that, we'll get to those, and I can go into a little bit more detail on the plan. We also have a required health and counseling fee, a totally different entity. It is only applicable to the Health and Counseling Center here on campus. That fee keeps us running. It's also what provides the free STI testing, the different health promotional events. It also reduces the cost of visits substantially at the Health and Counseling Center. So if you were to come in and see a counselor, the counseling sessions are $15 each with the health and counseling fee. Otherwise, it'd be $130 to see someone. And then medical appointments also start at $15, but the price will go up from there depending on services. So if lab work needs to get done, so something that's probably going to happen to a good chunk of the students is you're going to think you have strep or mono. So you come in to see the provider, it's $15, and then we can do a strep test. Normally it's $7, but with the health and counseling fee, it's $3.50. It reduces the cost of that. So you would come in and pay $18.50 for your appointment. So it really significantly reduces the cost of visits at the Health and Counseling Center. If you do opt in to the student health insurance plan, and you already have the health and counseling fee, the cost of the visits at the Health and Counseling Center are pretty much $0. The only time that you'll actually pay for something is if you're seeing a specialist. So we have 3 specialists on campus. So we have a nutritionist, a dermatologist, and we have our psychiatrist. All of those with the SHIP, the Student Health Insurance Plan, and the health and counseling fee, it's a $20 copay. With just the health and counseling fee, it's a $90 visit. Unfortunately, we do not bill to insurance, so it is always your student's responsibility to pay for the services and then submit an invoice to your insurance company. So I'm always telling parents, make sure you contact your insurance company to see if we are within network for you guys, because it would be a bummer if you were to come in and you can't get reimbursed for any of the services provided at the Health and Counseling Center. But regardless of insurance, we will see every student on campus, and we do Medicaid rates, so it's really very inexpensive. One thing that a lot of parents ask about is our counseling services here on campus. We run on a 10-session model. So if your student needs to see a therapist more often than 10 times in an academic year, that would be up to the counselor's discretion if they're able to take on that caseload. We are trying to refer out to the community a little bit more for more challenging patients that need to see a therapist weekly or bi-weekly, and we have made some really awesome connections, and you can definitely give us a call and we can give you a referral list of 30 pages long so you can find a therapist that will work for your student. The next thing I want to talk about is HIPAA. So that's the Right to Privacy Act, and we follow that to a T. We might be a little bit more strict than most primary care providers. We require that if a student is willing to disclose information to a parent, they need to fill out a release of information every single time they come in for an appointment. We don't do blanket releases like other places do. We just really like students to be sort of autonomous and take responsibility for their health care, and that's why we do part of that. And I want to make it very clear, if you've signed the FERPA, the Federal Education Right to Privacy Act, it does not cover HIPAA laws. So you do need to sign 2 separate waivers for that, or your student, sorry, would need to sign 2 separate waivers for that. A lot of questions that have been coming up in regards to that is if your student is under 18, you still have access to their medical care, but you do need to sign a waiver that allows your student to come and get medical care at the health or counseling services at the Health and Counseling Center. It's all available on our website. And again, you can give us a call if you have any questions on where you need to find that. We're happy to help. I'm sure a lot of you have been receiving those emails about immunization records. The state of Colorado requires that all college students taking classes on campus need to provide proof of 2 measles, mumps, and rubella vaccinations. So it might be notated as MMR on your vaccination record. So we need 2 of those. And because your students are probably going to be living on campus, we do need to have proof of a meningococcal meningitis shot administered within the last 5 years. If you are unable to provide proof of that, you can get something called a titer test. That test is a blood draw, and it will prove immunity. It counts your antibodies in your blood to see if you have immunity or not. And if you never got the test and you don't want to get vaccinated, or you've never been vaccinated and you don't want to be vaccinated, you can sign a waiver. We just like to remind everyone that if there were to be an outbreak on campus, you're going to be asked to leave. You're not going to get reimbursement for any time missed on campus, and that's including if you miss quizzes, test labs, things like that. What else with immunizations? We are getting hundreds of immunization records in every day as we get closer and closer to orientation. So if you haven't done it, do it as soon as possible. There's a hold on the account. It would be a huge bummer if your student came to register for classes and they couldn't because they couldn't submit their immunization records in on time. And the sooner the better. It's taking us a little bit of time to get through those at the moment. The deadline for the health insurance, so you don't need to worry about this right now, but it's the 29th of September. So if you want to opt out, you need to do it after your student has registered for classes, and that's the 29th of September. Otherwise, you will automatically be opted in. Most of you guys should have already seen that the fee, the SHIP, has been assessed to your student's account. So if you want that gone and given back to you the $1,465, make sure you go and waive that. Those are some of the highlights. I'm happy to answer any questions from you guys.
Okay, we're going to open it up for a Q&A. Please type all of your questions into the chat box. So the SHIP fee, that $400 fee, is it per quarter or how is that split up?
So it's for every 6 months. So it will cover you for a full year. So there's never a gap in coverage. So it's $1,465, and you'll be covered starting the 1st of September all the way through the 27th of March. And then we have 2 open enrollment periods, which is so that if you need to get insurance, you can, and you'll opt in the spring quarter for the second part, and you'll pay another $1,465. The health and counseling fee, on the other hand, is a quarterly fee, and so that's $195 a quarter. We do not automatically assess the health and counseling fee over the summer because most students aren't taking classes, so you only pay that usually for fall, winter, and spring.
Is there a way to check that you have received the immunization records?
So if you've sent it over email, there's like a generic response that says, thank you for sending your immunization records. It takes about 48 hours to process, and that's usually the only way that you're gonna get an email about it. The best way to check is to go onto your student's Pioneer web and check the hold status. If the hold has been lifted, then you know that the immunization records have been sent. If the hold hasn't been lifted and there was an issue, an email will have been sent to your student's DU email account. So the best way to check your student's DU email account is by going to the school's IT webpage, and there's like a little white box that says Outlook 365. The login or username is usually their first name dot last name and the same password as their Pioneer web. So that's what we suggest to do. If you haven't received an email and there's still a hold and you sent the records, give us a call. We have been having some technology related issues this summer, which has been just putting holds back on even though we have lifted them. So just give us a call and we'll make sure to get that all sorted out for you.
Did you give the number? Sorry.
Yeah, our phone number is 303-871-2205. And if you would like to speak with a person, you can press 1 and speak with someone.
Okay, so the question is stated, is the health plan on campus in network for the SHIP plan? So
Yes, actually, we become your primary care provider if you opt into the SHIP plan. It's, again, run through United. So if you're ever more than 50 miles away from campus, you can hop onto their app or to their website and find out who else is in network. And because it's through United, it's a really large network of providers. But again, we become your primary care provider, so you would have to come to us first to get referrals out.
can you discuss the process for seeing a specialist?
Yeah, absolutely. So with our health insurance plan with SHIP, you do need to come in first to get a referral out. We have a very long list of specialists that we work pretty closely with that we can refer you out to. But if you want to see a psychiatrist, nutritionist, or dermatologist, you come in, get a referral for one of those three, and then we can see you in our offices. It's significantly cheaper than going out and seeing a provider outside of campus.
Are the hospitals in Denver working with health and do you providing them?
So I'm assuming what this question is asking is, like, if there were an emergency situation, would we communicate with the hospitals? We do actually, we have some capacity to work with the hospitals. We do have access to some records if there were to be an emergency. But it's not something that's a big issue. It's not like we're not sending people to the ER all the time. But we do work with hospitals in terms of referrals, if that's what you're asking. We send a lot of people to Porter for imaging. They have a really good imaging center. But we are very well aware that we're dealing with students in a population that might not have a ton of income. So we are trying to find the best solutions in terms of money and budgetary restrictions. So we don't usually go to hospitals because they're more expensive.
Can you have a HIPAA filled out in general in case your child needs medical care that is not a planned visit and parents will want to be able to be contacted? It's important.
So if there is like a big emergency, medical providers have the right to contact the parent and have a discussion. Particularly this happens with mental health. If the provider believes that the student might hurt themselves or others, they might reach out to the parents. But that's only in the case of emergency. Otherwise, the student would be responsible for filling out a HIPAA form every time they come in.
Okay. My student is seeing a physical therapist on a weekly basis. Can you help her get a new PT person close to campus?
Absolutely. My suggestion would be to give us a call and we can connect you with someone who's close to campus. Your student's also more than welcome to come in and see someone. We do have 2 doctors who specialize in sports medicine, so they're very familiar with going to PT. Off the top of my head, the one that we use most often is at Anschutz Medical Campus. So if you want to look into that, it's a little ways away, but it's probably the best program in the state for PT.
Can we spell Anschutz for them?
Yeah. How do you spell it?
That was Anschutz Medical Campus at ANSCHUTZ, correct? Anschutz.
Yes.
Yep, Anschutz Medical Campus, yeah.
Yeah. And then the next question is, if your child is not on campus over the summer, do we have to pay for the? No. So the health insurance you will have to pay for because it's an annual thing. And that's so, there's no gaps in coverage and we want to make sure that your kid's insured. So if anything were to happen, you have coverage. The health and counseling fee is not automatically assessed over the summer unless your student is here taking a class. Otherwise, you're not obligated to pay for it. But the health insurance is a 12-month thing.
Okay, so where can they find details on the coverage for the SHIP program to compare to what they have now? If we opt out, do we need to provide you with coverage proof? Where do we go to opt out?
Yeah, great questions. The first part is it's all on our website. We literally just got the informational brochure from United this week. So you can definitely go on and see all that information there. You can also go to United Healthcare Student Resources and search University of Denver, and all their very lengthy brochure is in there, so you can check out that information and compare different coverage options. If you do opt out, it's all done on Pioneer Web underneath the student tab. There's a waive/enroll option for the health insurance, and when you opt out, you will need to provide proof of coverage there. Again, we don't bill outside insurance, so even though you're providing that proof, it doesn't mean that we're going to bill to them. It's just an institutional standard that everyone has health insurance. Yeah, it's all online.
So we're repeating questions so that everybody knows what we're answering also.
Right, so,
Yeah.
Okay. If a student is incapable of consenting to HIPAA release due to mental or physical incapacity, how do parents get adequate information?
Yeah, again, if there's a big issue, the parents will be contacted as long as they're listed as the emergency contact and all the documentation. And that, again, is through Pioneer Web. You can have all that information added. So you will get notified if there's an issue happening with your student.
Okay, so we have private insurance. How much of a bill can a student run up? Hundreds, thousands? My son is a type 1 diabetic and occasionally needs an IV if he gets stomach flu.
That's a great question. You know, it really varies on the services that are provided. I have never seen anything go over $500 on a visit, and I know that sounds like a lot, but that was probably with 50 to 60 labs run, and every time you do a lab, those add up. Again, they're pretty, the cost of coming in can be pretty inexpensive compared to most places. My suggestion for you is, you know, maybe find someone that's within network here in Denver that your student can go to regularly and establish care somewhere there so that they bill out, so you're not expected to pay upfront for your visits. But we definitely do IVs for students all the time. We get a lot of people who get dehydrated here with the stomach flu, and I would say you're probably paying $100 for a visit like that.
Is private insurance accepted at the campus clinic, Blue Cross Blue Shield, or others similar?
Yeah, so it's your responsibility to contact Blue Cross Blue Shield. Their plans vary. And so if we are within network, that's great. You still just have to pay out of pocket and submit the invoice to insurance to get reimbursement or for the cost of the visit to go towards your deductible.
We plan to cover our son under our present healthcare plan. How do we avoid being billed for DU's health plan?
Yeah, so you will go log into Pioneer Web once your student has registered for classes, and you will need to waive or enroll. And once you've waived on Pioneer Web, it will prompt you to add your private health insurance information.
What is the closest hospital?
Porter is the closest hospital to campus. It's like a mile away.
Can you please write down the company provides with insurance?
Yeah,
so
it's United Healthcare Student Resources.
Okay. Can we use a different primary provider in the summer?
So if you are within 15 miles of DU and you are on the student health insurance plan, it's still your responsibility to come into the Health and Counseling Center to see a primary care provider. But say you live in, you know, Texas and your student has come home over the summer, that's clearly more than 50 miles away. All you need to do is find someone that's within network, and you'll be able to get reimbursed for your services.
Okay, this is a long one. This is more of a general question regarding pre-purchase care packages. Do you know if there is a company that advertises specifically to DU parents to have goodie basket type care packages sent to their student periodically throughout the year? I haven't received any advertisements for this. I get ads for this from another school and was curious if you knew anything about this for DU students and or if it what is recommended.
I can answer that one.
Okay, great.
There is a local company called Fruit Revival, and I can get their website for you and post it on our follow-ups. But if you Google Fruit Revival Denver, then they have a University of Denver, care packages page on there. So, Google Fruit Revival DU, and that should get you right to their page. But I'll follow up after this with their website.
Insomnia cookies, I hear, is a big favorite around campus because they are open until like 3 in the morning. And so if your kid is having a rough time, late night studying, you can have cookies delivered to the library.
Okay, if our son is using DSP services and will probably use the health center services, do the records we submit to DSP get shared with the health center?
They do not. They don't automatically come to us. You can certainly ask DSP to fax over the records to us. We can upload it into their records. Or you can email it to us, or you can fax it to us. Our fax number is 303-871-4242. And then our email is info@hcc.du.edu. So if you want to send those records to us directly, you can.
Get that right? info@hcc.du.edu.
Yeah, that's perfect. Okay.
And the fax number?
303-871-4242.
Yeah.
Yep. Okay. Can you clarify when we pay the health and counseling fee? First year's registered for class September 6th. Is it after that?
So the health and counseling fee is a quarterly fee, and it should already be assessed onto your student's account at this point. If not, it will definitely be registered or assessed onto your account once you have registered for classes. And you'll pay that with your tuition bill.
That's $159, right?
$195.
Or, yeah,
Right.
that's it. I'm glad I asked that. $195 per quarter.
Yeah, per quarter.
Just want to make sure that they have it. There we go.
So I'm assuming that this next question is a follow-up, and it says, so even if we make the DU the primary care provider, and I'm assuming it has to go with.
I think it came right after when you were talking about can we use a different primary care provider in the summer?
So if DU is the primary care provider, if you have like our health insurance, the student health insurance plan, you can definitely see someone elsewhere. If you want to make DU your primary care provider, that's totally acceptable, and you can come in over the summer. If your student's not taking classes, the health and counseling fee won't automatically be assessed. So if you want the health and counseling fee, we can add it onto your account over the summer if you like, so that you can see someone.
Are there more questions? Yes. Okay, if it is the middle of the night and the student has ketones and vomiting, how will they get to the ER if they have no car? These things don't always happen during business hours.
The first thing is we do have something called protocol. So if you call the health and counseling center after our regular business hours, you will be able to speak with a provider and sort of see what's going on. I know taking an ambulance is not the ideal thing. You can always call 911 if it's a big issue, and then there's Lyft and Uber that can get you there, or maybe a friend. I don't believe campus safety will be able to take you to a hospital. But my first step would be to call the health and counseling center. You'll be able to speak with the provider.
Is our dentist appointment and
It's probably ophthalmology.
Yeah, covered in the SHIP plan.
So if your student is under the age of 19, pediatric dental care and eye care is actually covered. It's okay coverage, it's not spectacular. We do offer an additional dental plan through Delta Dental of Colorado. And so if you would like to look into that, again, that information is available. It is an additional $390 cost to opt into the dental plan through Delta Dental. That can be paid either by credit card, check, or cash, and we just need you to fill out a form. And if you give us a call, we can walk you through the process of getting you enrolled in the Delta Dental plan.
What are some of the other health and wellness activities available around campus, like flu shots, nutritional or fitness information?
Yeah, that's a great question. So we do a flu shot clinic every year for students. We do a lot of STI testing. That's probably one of our bigger services. It takes up a lot of our time, and we love doing that. We also have a lot of stuff to do with our sexual assault and awareness programs on campus, just providing people with information about how to be an active bystander, the resources that are available around Denver. We have like open table sessions. We also do a lot of mental health crises intervention on campus. So if there were to be an incident on campus and we need mental health providers right then and there, we have the capacity to do that for students. A lot of the times it sort of ebbs and flows with what our students' needs are. So if students ask us for something, we're often right there trying to figure out a solution.
Is DU a bicycle-friendly campus? Will bicycle purchase or rentals be available on campus on movement day?
Bicycle friendly is the name of the game here. I think probably the majority of students have bicycles to get around campus, and I'm not sure about the second half of that question.
I believe the sustainability committee has done bicycle purchases in the past. I'm not 100% sure on that, so
they'll advertise that to students pretty much right away. If they've got some bicycles already, students will know about it. And then also Campus Safety has a sale once or twice a year, and they'll advertise all over through the residence halls and to all the students on their email accounts and in other ways that they're having a bicycle sale. So sometimes when students leave at the end of the year, some of them just leave their bicycle in the racks, and then Campus Safety holds on to those, and if nobody comes to claim them, they sell them the next year. And there are really good prices. There are also a few bike shops close by that your students, if they Google, or get onto their maps, and say close to me bike shops with bicycles, they'll get a lot of good information that way too, and they can probably get to one quickly. Plus they could use their transportation pass to ride the buses and light rail for free. So they can probably get to a bicycle shop pretty quickly and easily.
Okay, so this question was a follow-up to the first one. So there's no actual staff at the HEC after hours, but there's an on-call.
That's correct. Yep, that's how we function.
Is the DU clinic open 24 hours, or is there an emergency clinic near the university that is open 24 hours, other than hospital emergency rooms?
So we are not open 24 hours. We do offer extended hours during the school year. So we're normally open from 8 to 5 every day, but on Wednesdays and Thursdays, we stay open until 7 o'clock. There are quite a few urgent cares in the area. We refer out a lot to Rocky Mountain Urgent Care, and then there's an AFC urgent care that's pretty close by to campus.
Last week it was mentioned that first year students typically take 3 classes during their first quarter. Is that 3 classes in addition to their FSEM, or is it 2 classes plus FSEM?
I believe it's 2 classes plus the FSEM in that first quarter. The FSEM course is just 1 quarter long. And that was a recommendation by academic advising. But if you want to clarify that a little bit more, you could contact the academic advising office and ask them that question. 303-871-2455. That's the academic advising office. But I believe it's 2 classes plus the FSEM, and that will be 12 credits. So that's a full-time credit load here.
Can health insurance be waived before the students are on campus?
So the only way that it can be waived is if your student has registered for classes. I think the vast majority of students register on the 6th of September, I believe is the date.
6th or
6th or 7th.
The Thursday of orientation is when your student will register classes.
I know a small group of students who have been able to register early for with different learning disability reasons, things like that.
You'll know that they've registered for classes because the following morning, the tuition billing will pop up in your email. Yeah.
Would you mind repeating what medical services are provided on campus at the clinic?
Yeah, absolutely. So we act like a primary care facility. So we can do assessments, things like that. We can also do like asthma testing, STI testing, anytime a student comes in for a sore throat or thinks they have mono, like the big stuff that happens on college campuses, we could do testing in clinic. We are an integrated facility as well, so every time you come in to the Health and Counseling Center, if you need to, you can speak with a counselor in your medical appointment as well. Again, we act like a primary care, so anytime you go to just a doctor for a checkup, we can do physicals, things like that. It's pretty broad what we do. We don't have any kind of like sports med specialties, which I think is a big topic here in Denver. A lot of people get injured, so we don't offer PT, but we can get you referred out to a place that does offer PT or chiropractors, things like that.
If your student uses private healthcare, is the copay expected at time of service or will parents be billed out?
So you will get a bill at the time of service. You are by no means obligated to pay when you are there. You can pay online to follow HIPAA laws. It's a little bit complicated, but the bill, the total of your student's bill is on their My Health portal. It's a really convenient portal. You can go online, make appointments, see when appointments are coming up, see your immunization records, do release of informations. All of that can be done on the My Health portal, including viewing the bill. You do have to go to a secondary website to actually pay off the bill. So if you go to the Health and Counseling website, on the main website, there's a link that says pay my bill, and that's where you will go to pay the bill. We're also happy to take payment over the phone. I just always suggest doing it within 60 days. If you don't pay off the bill within 60 days, a hold is put on your student's account. And most insurance companies will not reimburse after 60 days from the visit time.
Also for this parent's diabetic student, he is on an insulin pump and enters the carbs for the food he eats. Do the dining halls have carb listings for food being served?
That's a great question, and I don't know the answer to that, but I am happy to do some investigating, and I will figure that out for you.
Is the clinic walk-in or by appointment? Is it difficult to get an appointment? Their son at ASU said it's usually a week to get into their clinic. Is DU similar?
So for medical, we are on a same day model. So you can either go on the night before on your My Health portal and get an appointment or schedule an appointment for a health visit then, or you can call us the day of and we can get you scheduled. The only exception to that is if you're doing a physical or if you need to get an allergy shot, we can do that a little bit ahead of time. Because we do same day, it is very easy to get an appointment the day of that you want to come in, but we do not offer any walk-in for medical. On the flip side of that, if you are coming in for a counseling appointment, it can be a little bit of a wait to see a counselor. The way our model is set up is that you have an initial appointment with a counselor. It's a 30-minute brief screen. You discuss what you want to get out of counseling, what you need, and that 30-minute is at no charge to your student. But to get those 30-minute initial brief screen appointments, it can be challenging. So we offer something called same-day access. Same-day access can either be for crisis, or if you really need to get one of those intake appointments, the brief screening scheduled, so you can see someone regularly at the Health and Counseling Center. We do offer that. That's every day from 2 to 4 p.m. You can see a counselor. So as long as you enter into the HCC between 2 and 4, we'll make sure you see a mental health provider.
So this next question is off topic. Are flex dollars added to the student's DUID? If so, is there a PIN number required when swiping the card? What happens in the event the card is lost or stolen?
Great question. Flex dollars are added to the student's DUID. If the student loses that card, it can be used just like any other credit card. I mean, you know, for the businesses surrounding DU that take flex dollars, that is. So if your student leaves that behind in a common area, if it is, you know, if it walks away, if it's taken, they need to treat that card, you know, just like it's their bank account. And if they realize that they have lost it or it's been stolen, they should talk to someone over in the ID card office right away, because they can electronically shut off the card. And they will do that immediately. And your student can have it reissued, but I believe that the fee is $25 to have that card reissued. So I would impress upon your students how important it is for them to hold on to that. It's their way to access the residence halls. It's their, you know, flex dollars, it's their meal plan. So they will notice if they don't have it. Yeah.
On that note, we don't take flex dollars at the Health and Counseling Center. Get that a lot.
No. Okay, so this person is confused. When you say we cannot waive the health insurance fee until after registration, they went online to waive the health insurance fee and input their private policy info. Do they need to waive again?
So we've had some people who, for some reason or another, have been able to go in and waive. My suggestion is, once your student has registered for classes, just to go in and double check and make sure nothing has been populated back in there and you need to waive it again. Otherwise, you can give us a call at the Health and Counseling Center and we can actually go and check the records. But it shouldn't have been, you shouldn't have been able to do it because it's based on how many credit hours you're taking, if you can opt in or opt out online.
Can you discuss mental health counseling services? Can a student have a regular counselor?
So once you start seeing a counselor, it's a counselor you will be seeing throughout the year, unless you don't like the counselor and there's a process to have you see someone else. But we do run on a 10-session model. So you are given 10 sessions each school year, and they reset once you come back in the fall. And so that's usually how many you're going to be allotted. If you have a student who needs a little bit of extra attention, depending on the counselor's caseload, they might be able to extend how many cases, how many sessions they're willing to take on. That does change the cost of the visits, though. Once you hit that 10 session and you haven't gotten a fee adjustment, the price for the counseling will go up. And it's $130 per session unless you get a fee adjustment. If you have the health and counseling fee and the student health insurance plan, normally you don't pay anything for those visits. You end up paying a $42 copay once you've reached that 10 session mark. But we do have options to do fee adjustments if that's something that we need to do for your student.
Can anaphylactic allergies be handled in the medical center? What about after hours?
We do have protocol for if there is an anaphylactic emergency, but it is always better to call 911. It's going to be a faster response time because we don't have like emergency care. And after hours, again, it would be calling the help with the 911.
If you are referring to a specialist such as an orthopedic, can you assist to ensure the student is referred to an in-network physician that's facility for personal insurance such as Blue Cross Blue Shield?
We try to do that as often as we can. We are very closely tied to United, so if you are within United, we do know if you are going to be referred to someone who's in network or not. We're obviously here for your students, so if they give us a call, we can help them figure out if a provider is within network or not. We want to give them those skills so when they're no longer at DU, they know how to find that information.
Okay, can you tell them again where the HCC is located?
Yeah, so we are located in the Ritchie Center. It's a building you cannot miss on campus. It has the gold steeple on top of it. It's also where the hockey rink is, and we are located on the north side of the building, and that's where both our medical and counseling is located. We do have a satellite location for our counseling. Our counseling team has grown a lot in the last year, and that's our Asbury location, and that's only for counseling, and that's located on the corner of University and Asbury. And I can third floor. Okay. There you go.
With a lot of lab testing being sexually transmitted infections, testings, are there proactive student reminders, as education on healthy relationships and encouraging prevention throughout the year?
Yes, I love this question. We are so on top of this. We have free condoms at the Health and Counseling Center at both of our locations. So if your student wants to come in and grab those, we have educational pamphlets. You can always talk to a nurse if you have any questions. We also provide an Ask a Nurse opportunity around campus. So if your student wants to come in and ask a question that's actually not going to be on the books and it's completely free, you can go and ask a nurse. Our health promotion team does a lot about education and understanding what a healthy sexual relationship is, what the resources on campus, are if you're not in a healthy relationship. We have a really strong CAPE team. They deal with advocacy and prevention for survivors as well, and they do a lot of informational stuff for students.
My child has severe food allergies. Are resident hall staff and dining hall staff trained to respond to an emergency?
That is a question that I don't know the answer to, unfortunately, but I certainly can get back to you.
That's a really good question. I don't know if resident hall staff is CPR certified. I know resident directors are required to have CPR certification. I'm not 100% sure about resident assistants though. So we can follow up on that.
Yeah.
Okay. What do students, or where do students sign up for FIRPA?
Pretty sure it's all on Pioneer Web. Yeah. You can waive it there. Pioneer Web is your helping hand throughout all this.
Can our student make an appointment now for the first 30-minute session with the counselor if they know they want to see a counselor regularly?
Yeah, you can give us a call, but you're only eligible to be seen after the 1st of September. So we can schedule you after that point, and we can make that first 30-minute free session screen done for you.
Off topic, how do you load money onto a Pioneer card, and is that different from the DU ID card?
It is the same. The Pioneer ID card office, I believe it is Pioneer ID card. Let me see. du.edu/Pioneer card. On that website, there is a way to electronically load a Flex Cash onto the card for your student. I believe all it takes is to create a login and password. Your student might at first need to give you access to that, but then you can have your own login after that, and you can go on and load it with whatever they need. They also do laundry with that card. They can do a lot of things with that. Use, at the cafes on campus. You probably already know all that, but yes, online adding to your card is possible.
Does the Health and Counseling Center offer meningitis B inoculation?
We do. We definitely do. They are expensive though. So I would look into contacting your primary care, like if there's someone within network here that's willing to bill out, so you don't have to pay an outrageous price to get your meningitis B, because it is a 2 series vaccination.
We have another question about RAs in the residence halls being trained in emergency procedures. We will follow up on that question so that you have the correct information about that.
Everyone at the Health and Counseling Center is CPR certified. We're all doing our renewal in September.
And all students should also be educated on emergency action plan within the residence halls. But once again, we'll follow up on who is CPR certified and so forth. What are the other mental health services available outside of seeing counselors in the health center?
So we have a lot of mental health services, but it's mostly seeing counselors in the Health and Counseling Center. We also have we have 3 psychiatrists. So if your student needs to be prescribed anything, they can see a psychiatrist. We do have something called Let's Talk. It's usually offered in the library. It's an off-the-books conversation with a counselor, not in the Health and Counseling Center. So your student can come and just have a discussion with a counselor. A lot of the times it's just talking about the services that we provide and maybe what the next steps are. It's usually offered for students who are a little bit more apprehensive about seeing a counselor, to sort of understand what services are provided, and understanding that seeing a counselor is not a bad thing. It doesn't mean you're weak, things like that. We always have someone on call during the workday. We have a counselor of the day, so if there is an emergency, we can see you. We also offer group therapy for a variety of different things, from grief to gender identity and sexuality, things like that. We have a lot of stuff that we offer. All of it's listed on our website too.
Do both Health and Counseling accept Anthem, Blue Cross Blue Shield?
Again, that you would need to contact them because plans do vary depending on the tier plan that you're on.
In your experience, do we need to notify our private insurance if not using VU Healthcare?
I would just contact them to make sure that we're within network, so you can send an invoice to them to get reimbursement. But usually you don't have to notify. The only exception I would make to that is if you are like on a Kaiser plan and you know that your student's going to be going out of state, and make sure that the Kaiser, because it's an HMO, will work for your student here in state.
Anything else we should know or do with having a student with a chronic mental illness such as type 1 or medical illness such as type 1 diabetes? We have the Health and Counseling Insurance online. We will be in contact with endocrinologists at home in Nevada on breaks.
I think that the best thing to do is come into the Health and Counseling Center and just see a provider, and make sure that you fax over all pertinent medical information so that we have it on your student's chart, so we're not asking for all the same information over and over again. It's really helpful for continuity of care.
Is there an urgent care within walking distance or on train route?
There is not one that I can think of on the train route. The closest one is about a mile or so away. So, no, it's not going to cost a lot of money to take an Uber or Lyft if you have the capability to do that.
Back to the Pioneer card. Are debit cards accepted throughout campus for services, or is it all done on a Pioneer ID card?
So you can definitely use a debit card for anything that you purchase on campus. I do that all the time at the cafes, or if I'm just going for a coffee, I just use a debit card sometimes. So that's acceptable. There's also US Bank is here, a very small 2-teller branch is here by the bookstore. and that can be loaded onto your student's Pioneer ID card. So basically they can have their bank account on there as well. Wherever they go on campus or at the local restaurants, they can tell them, use my Flex dollars for this. If they're on campus, it'll be automatically, from their Flex account unless the student says differently. By no means do you need to have a US bank account. That's just there for convenience. There are also several other banks in the area like Chase, Wells Fargo, TCF Bank. You could Google it and find the different banks. There's also a credit union, Public Service Credit Union, very close by, and they are on the network of credit unions. So if your student already has a credit union account, they can do business inside their branch as well. Just probably way too much information than what you needed, but yes, you can use debit cards here on the campus as well.
Sorry about our video being frozen. We're gonna just continue. As long as you can hear us, that is truly what matters. So sorry about that. Okay. Any comments or suggestions to ease our minds regarding preventing student marijuana use? I am thankful to use a smoke-free campus, including vaping.
I guess my big comment for that is that if your student happens to get caught using really any kind of drug or alcohol on campus, we do have, there are some repercussions to that, and we have an AOD and alcohol and other drug specialists that we are hiring, but some students are required to actually sit in with and do a two sessions of counseling that's outside of the regular 10-session model that we do, and it does cost some extra money, but you discuss what the repercussions are of using alcohol and other drugs, and we are happy to provide any kind of educational information to students if they have any questions about it regarding either mental health or physical health using really any kind of drug.
On a similar note, does the health center provide substance use prevention education support, or is that a separate entity?
Yeah, we certainly do. We have helped a lot of people with substance abuse on campus. The first step would be to come in and see a medical provider, particularly if you want to go to a rehab facility. I don't know if that's the direction you were going with that, but that's how we can get you into a rehab facility. But we are always there as a support to guide you on whatever path you need to be or want to be guided on when it comes to getting care for substance abuse.
Can you tell us the name of the urgent care that is 1 mile away, and repeat the name of the closest hospital so that I can check that they are in network with our insurance?
Yeah. So Porter Hospital is the one that's the closest to us, but we're also very close to Swedish hospital, and not too terribly far away from Anschutz Medical. The closest urgent care is AFC. And we also report to Rocky Mountain urgent care, or refer to.
There we go. Yeah. Okay. Can you tell us that? Oh, we just did that. Okay. Do you know what the ATM fees are on your end for cards that are out of state?
I do not know what the ATM fees are. No, I think that the last time that I used them, because I don't have a US bank account, I think it was $2.50. And then I was also charged by my own bank for using a foreign ATM. So you could check that out actually if you go on US Bank's website, because those are the ATMs on campus. And the other ATMs, the other banks and the credit union, they're very close walking distance. But for convenience, I know your student is going to walk up to the nearest one and just use it. But you could go on the US Bank website and find out what their foreign ATM fee is, what their ATM fees are, for someone that doesn't have their account. And then go on your own bank or credit union's website and find out what the foreign ATM fee is, because that's what they call it when you use another provider's ATM. So you get double charged.
Uh-oh.
What is all that stuff up there?
Someone's screen sharing.
Okay, not sure if you can hear us, but somebody is screen sharing with us.
Chris Ladd. Make it full screen.
Oh, okay. There we go. We got it back. See if you can use that little menu and put us back on.
We are on.
Oh, we are. Okay.
Yeah,
Okay.
but our
Um,
video is frozen, so.
okay, our video is frozen, but let's just make sure you can still hear us. Can somebody just type in yes in the chat menu if you can hear me? Yep, perfect.
Awesome,
Thank you.
thank you.
Okay, we'll keep going for just a few more minutes. I realize that we are over our time limit right now, but we'll go ahead and answer the last few questions that have come in on the chat menu.
If you do have any more questions, please feel free to email us at parents@du.edu and we can get back to you. I need to. But the last, we have 1, 2, 3, 4. We have 5 more questions, and that's all we will take for now. Are there AA meetings on campus?
So we have group therapy, and sometimes they are catered to alcohol or drugs. It depends on the need of the student population. So if there are people asking for it, we will do it. This year it was not offered. We didn't have a lot of people asking for it.
You mentioned giving away free condoms. Are other birth control and STD test, education, counseling available, and what are the costs?
Yeah, so the free condoms, we do free STD testing. We are trying to make it far more regular than what it is right now. I'm pretty sure it will be once a quarter this coming school year. If you do come in and you want to speak with a medical provider, we can set you up and do a birth control counseling session with them to walk through the options. We do inject depot shots if that's something that your student wants or is interested in. We have a very small dispensary. Most of our medication is like amoxicillin if you have strep throat, things like that. But we can definitely write a prescription for birth control and have it sent to a pharmacy that's close by.
What is the closest pharmacy?
We have quite a few. So Walgreens and Safeway are definitely the closest. And then there is a CVS, it's in a Target that's not too terribly far from campus.
Do you have a specific counselor who specializes in helping students with chronic health issues? Is it possible to ask for a specific counselor?
You certainly can ask for a specific counselor. The counselors that deal with chronic health issues are usually our senior staff members, so you can just ask for a senior staff member when you're making an appointment.
More about putting out prevention information, especially about the less obvious drugs such as study drugs. My son has been on campus this summer and is hearing a lot about microdosing of acid, use of study drugs, overdose of caffeine, etc., with the intention of expanding their thinking or being able to study better, in addition to the obvious alcohol and marijuana.
That's a great question. The Health and Counseling Center does a lot to try to prevent the misuse of things like Adderall. We have a really strict protocol. So if any student wants to have Adderall prescribed on campus, you have to see our learning assessment coordinator, make sure that you really truly need the Adderall to be prescribed, things like that. So we definitely limit the number of patients who are prescribed Adderall through us. We have been told that this is an issue, and we know that using study drugs is certainly an issue, and I think that that's sort of the direction that we are going in coming this next year, and I can certainly bring this up with my team to see if there is something more proactive we can be doing about study drugs. I have never heard of microdosing of acid, so I guess I need to study up and learn a little bit more, and we can make sure that this is something that we can provide to students.
And our last final question, is there Weight Watchers on campus?
There's not, but we do have a nutritionist on campus who comes in usually once a month. So you can speak with her. She can speak with the nutritionist.
Any last comments, Sharon?
Nope. That's it. We have several things to get back to you all on. I'll send a follow-up email and also post the follow-ups and our video from tonight on the Facebook page as well as emailing it to you all. And we appreciate everybody being here with us tonight. Join us next Wednesday. Our final webinar and Q&A is next Wednesday, August 30th. It's at 6 p.m. Mountain Daylight Time. And our subject for that night is going to be preparing for orientation. So even if you're not coming to orientation, this will be really useful for you if you want to listen on the webinar. You'll get a lot of good information about what your students' experience is going to be and about that first week and what to expect over the next couple of weeks. And I think that's everything. We're going to wrap up for the night. Thanks very much, everybody, and we'll see you next week.
Get your immunization records in.
Have a good night.
Have a good night.